listening to the Agent Survival Guide podcast, a podcast for today's insurance agents. Informing, educating, empowering, improving the way you do business in an industry that's anything but static.
In today's episode, we'll discuss crosswalking in the ACA marketplace, or what happens when your client's marketplace plan is discontinued. We take a look at what this means for you and your clients and how you can help them navigate these changes. How Plan Crosswalks Work in the ACA Marketplace by Emily Ryan. When a marketplace plan is discontinued, your client isn't left to wonder how to obtain new coverage. No, they're automatically transitioned or crosswalked to a new, similar plan in the same tier. This is sometimes referred to by others as health plan mapping, but the term the Centers for Medicare and Medicaid Services, or CMS, uses for this is a crosswalk. So, what does this mean for your clients? If an Affordable Care Act, or ACA, carrier is no longer offering a particular plan or is leaving the marketplace, your client will be notified that their current coverage is no longer available. After this, they'll typically be reassigned to a new plan from the same carrier or a different carrier with a similar network and the lowest premium. Crosswalks hold true for all carriers and plans operating in the federal marketplace. However, they may not necessarily occur in the state-run marketplaces. Each state-based marketplace reserves the right to crosswalk enrollees to a new plan or alert them that their coverage is ending if their plan is being discontinued. There are steps you can help your clients take to avoid being crosswalked. Before a plan is discontinued or a plan exits the marketplace, your client will receive written notification that these changes are occurring. This notification should come in the mail a few months in advance of the open enrollment period, or OEP. Encourage your client to stay up to date on all communications from their insurer. If your client receives notification that their coverage will be changing, they'll be able to select a new plan within the Special Enrollment Period, or SEP. Your guidance during this window is critical. Make sure to remind your client to select new coverage within the 60-day time frame if their new crosswalk plan is not ideal. Your client can also select new coverage during the OEP. By selecting new coverage, your client maintains more control over their coverage. It's worth saying, though, that the goal of the marketplace is to select the most similar plan for a client who's being crosswalked to a new plan. The selected crosswalk plan might even be the same option your client may choose anyway. What's important is that your client explores all available options in their market before selecting the new plan. You should always encourage your client to be an active participant in their insurance. All this may leave you wondering why crosswalks even exist. If the goal is to get them to a new plan anyway, why select it for them? It all goes back to the main goal of the Affordable Care Act. The ACA was designed to protect Americans who are susceptible to being underinsured or going without health insurance because they can't afford it. As a default, when plans are discontinued or carriers exit the marketplace, a client will be crosswalked to the most similar low-cost plan to help ensure that individuals don't go without coverage. Crosswalks also keep individuals in the health insurance exchange. For example, a few years ago, many carriers were exiting the exchange, but were still participating in the off-exchange market. By default, your client is crosswalked to another plan on the exchange to maximize coverage benefits. By auto-transferring a client to a new plan, individuals don't unknowingly go without marketplace coverage. This process greatly contributes to the low uninsured rate. Despite this positive outcome, there are a few things you should help your clients watch out for during an ACA crosswalk. When your client is crosswalked to a new plan, it's possible that their new premium will be higher than the premium they were paying. This happens because sometimes the closest approximation of coverage is still more expensive with a new carrier or plan. Individuals may also notice that their network is different. In the worst case, some prescriptions or doctors may not be available. To receive care while being covered, your client may need to select a new physician or hospital network. If your client wishes to continue seeing their current provider, this care may be more expensive than before. Additionally, if your client is receiving cost-sharing reductions, also called CSRs or subsidies, this may be applied to the new plan if your client's eligibility has not changed. If your client's income, household size, employment benefits, or similar factors have changed, they will have to update their eligibility application before receiving and applying subsidies. Any clients who currently receive subsidies will be crosswalked to a similar silver plan. Healthcare.gov has a calculator that you can use to estimate what your client's cost reductions could be. Check out the episode notes for this free resource. If your client is not currently sharing up-to-date tax information with the exchange, your client will be crosswalked without subsidy consideration. Please note that exchanges are required to deem an individual ineligible for tax credits if they have failed to file their federal income taxes for 1 year. Individuals have 90 days to resolve income inconsistencies if they are notified of a discrepancy by the marketplace. Coverage effective dates are also important to be mindful of. As for any enrollment made during the OEP, changes that are made before December 15th will have a January 1st effective date. For any changes made after December 15th, those changes will take effect February 1st. Other coverage effective dates may vary in state marketplaces. Check out the episode notes for our article about the differences in state marketplaces. In recent years, there have been a few newsworthy items to take note of for crosswalks. The Department of Health and Human Services, or HHS, made some changes to crosswalks that took effect for the 2024 open enrollment period. This included the elimination of the re-enrollment hierarchy standard and metal tier plan availability. First, for the re-enrollment hierarchy, marketplaces are no longer permitted to automatically re-enroll CSR-eligible bronze-qualified health plan, or QHP, enrollees in silver QHPs. Previously, these auto re-enrollments were permitted as long as the silver plan was the same product with the same provider network and had a lower net premium as the bronze plan they were enrolled in. Eliminating these re-enrollments leaves your client in charge of their own coverage choice. We recommend advising a client that is eligible for CSRs that a silver plan is the only metal tier plan they can apply those savings to. Often, a silver plan with subsidies is more affordable for most clients, but the choice is ultimately theirs to make. The other change has to do with metal tier plan availability and how crosswalking interacts with that. If your client is enrolled in a higher tier plan like silver, gold, or platinum that is being discontinued and there is not a plan of the same tier available with the same network, your client may be crosswalked to a new plan of a lower tier. Your client may notice differences in premiums and what costs are covered. If your client is dissatisfied with the plan they were transitioned to, we recommend suggesting a better suited plan during the OEP. Health plan mapping, or crosswalks, are one patient protection embedded in the ACA designed to reduce healthcare costs and eliminate coverage gaps. As your client's trusted agent, remember to encourage them to stay on top of communications from their insurer and educate them on crosswalks to put them in charge of their healthcare coverage. Ready to start selling ACA plans or to take your knowledge to the next level? There is no better place to start than The Complete Guide to Selling Affordable Care Act Insurance Plans. This free guide lays out why you should be selling these plans, how to market them, finding the right ACA plans for your clients, and more. Check out the episode notes for a link to this free ebook. That's all for today. We'll see you next episode on the Agent Survival Guide, where we'll teach you how to survive on a desert island. Huh? What? That's that kind of survival? Okay. Tune in next time for another great episode on the Agent Survival Guide. See you then. The Agent Survival Guide podcast is a production of Ritter Insurance Marketing, an integrity company. This episode was written by Emily Ryan. Script adaptation, recording, and production by me, Jeff Snyder. Podcast design by Urban Rivera. Follow along with our show wherever you like to listen. And make sure to rate and review our show on Apple or Spotify.